This is a summary of the CPIC dosing guideline for statins and variation in the genes SLCO1B1, ABCG2, and CYP2C9. This video will specifically discuss atorvastatin, fluvastatin, lovastatin, pitavastatin, pravastatin, and simvastatin and ABCG2, which were assigned a no recommendation in the guideline. Videos covering the recommendations for statins in SLCO1B1, fluvastatin and CYP2C9, and rosuvastatin and ABCG2 can be found on the PharmGKB website and on the PharmGKB YouTube channel. This guideline was published in February 2022 and replaces the previous CPIC guideline on simvastatin and SLCO1B1. CPIC assigns a no recommendation to a gene-drug pair when there is insufficient evidence, confidence, or agreement to provide a recommendation to guide clinical practice at the time of publication. Based on the evidence which was available when updating the guideline, a no recommendation was assigned to atorvastatin, fluvastatin, lovastatin, pitavastatin, pravastatin, and simvastatin with ABCG2. This is the PharmGKB atorvastatin pathway. A link to the original pathway is provided in the description below this video. Like other statins, atorvastatin is used to lower cholesterol production in the body by inhibiting the enzyme HMG-CoA reductase. It is transported out of liver cells by transporter proteins, including those encoded by the gene ABCG2. Although genetic variation in ABCG2 has been shown to affect a patient's exposure to atorvastatin, there is insufficient evidence linking this to a change in patient outcomes. As a result, CPIC is unable to provide a recommendation for atorvastatin and ABCG2. A no recommendation has also been assigned to fluvastatin, lovastatin, pitavastatin, pravastatin, and simvastatin with ABCG2, as there was only limited evidence available regarding any relationship between these statins and ABCG2. This guideline has been annotated on the PharmGKB website. This includes a summary of the no recommendations and excerpts from the guideline. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.